Now, it's one of those things that you dread but is inevitable, especially if you have children: head lice. In today's episode, we'll go through the causes, the symptoms, the treatments, and the ways to prevent head lice. Let's get into it. First, let's understand what head lice are. Head lice are tiny insects that live and breed in the scalp and the hair. They don't fly or jump and spread through direct head-to-head contact, and possibly through the sharing of hats, combs, and anything that touches the hair. The female lice lay eggs called nits, which attach to the hair shaft near the scalp. It is best to treat them straight away since adult lice lay about 6 eggs a day. Head lice often causes itching of the head, particularly behind the ears and the nape of the neck. However, sometimes there's no itching at all. The eggs, also known as nits, look like tiny oval-shaped yellowy white dots. The nits are usually located on the hair close to the scalp. Now, nits can sometimes look similar to dandruff, but they stick to the hair quite firmly, so it's not easily flicked off. Sometimes you can actually see the live lice, which are about the size of a sesame seed. Now let's discuss the different evidence-based treatments for head lice. There are several over-the-counter treatments available. The two main categories of over-the-counter treatments are physical insecticides and chemical insecticides. Both are equally effective at killing the lice, but physical insecticides also kill the nits. Physical insecticides coat and suffocate the lice and nits. Some examples are dimethicone, benzyl alcohol, and isopropyl myristate. The physical insecticides are the recommended treatment as there is no chance of the lice developing resistance to these. They are safe to use and can be used in pregnancy. They can be used in children. Some are recommended from 6 months, some are recommended from 2 years. It's best to refer to the product packaging. You only need to leave these in the hair for about 10 to 15 minutes and they don't cause irritation. Some of the products will recommend you repeat the treatment in 7 days. However, some of the products only recommend you to check the hair in 7 days. I always like to recommend you treat it in 7 days, just in case you did miss any of the nits. Now, after you do the first treatment, you may still find the dead eggs attached to the hair. You could physically remove these with conditioner and a fine-tooth nit comb. Chemical insecticides work on the nervous system of the lice to kill them. They're effective but are generally recommended less as there is a chance that the lice can develop resistance to them. Examples are malathion and pyrethrins and piperonyl butoxide. These treatments need to be left in the hair for 10 minutes to 12 hours depending on the product. They do need to be repeated in 7 days. The chemical insecticides only kill the live lice, so you do need to make sure you remove all the nits with a fine-tooth comb. If you don't remove the nits, they will hatch after a number of days. Now, there are some at-home treatment options you can use if you prefer not to use the insecticides. There is a really cheap at-home method you can use called the 10-day conditioner method. Here are the steps for the 10-day conditioner method. Apply lots of conditioner to the wet or dry hair. This can help to temporarily stun the lice and loosen the nits to make it easier to remove. Comb through the hair with a regular comb. Then go through the hair in sections with a fine-tooth comb and physically remove the lice and nits. Continually wipe the comb on a paper towel to check that you're removing the lice and nits. Repeat this every day if possible or every 2 days for a 10-day period. Now, if you find any live lice, then you will have to restart the treatment from day 1. This can be very tedious and time-consuming. Sometimes, if you can't remove the eggs with a fine-tooth comb, you may need to use your fingernails. There are some more natural treatments you may have heard of, such as olive oil, coconut oil, tea tree oil, and mayonnaise. There isn't a lot of evidence as to whether these are effective, but it's unlikely to cause much harm. Here are 2 tips to prevent head lice. Tip number 1, avoid head-to-head contact and avoid sharing anything that touches the hair, such as hats, combs, and headphones. Now, head lice can't survive long out of their hair. At most, they will live for 1 to 2 days. To take extra precaution, it's recommended to wash bedding, clothing, and anything that touches the hair in hot water of over 60 degrees Celsius or 140 degrees Fahrenheit. And if you put them in the dryer on high heat, it's likely to kill all the lice. And if you want to be extra careful, for any items that can't go in the wash, seal them in a plastic bag and leave them for 1 to 2 weeks. Let's go through some commonly asked questions regarding head lice. So, what can I take in pregnancy? Most of the physical insecticides are safe to use in pregnancy. One of the chemical insecticides, pyrethrins, is considered safe to use. Avoid the use of malathion as there are better options. Ask your pharmacist if unsure. Do I have to treat the whole family? No, you don't have to treat the whole family unless there's evidence of head lice. It's a good idea to go through the hair with conditioner and a fine-tooth comb to check the hair for an infestation. Can you catch them from pets? Head lice survive on human blood, so you can't catch them from pets. I've used several treatments and nothing is working. What do I do? There are special head lice clinics around the world which use a treatment called air LA. This uses a special device that uses heat to kill the lice and nits. It is very effective. I don't have anyone to help me with the treatment. Can I do it myself? Whilst the physical insecticides are designed to kill the lice and nits, you won't have anyone to check the hair in case the treatment didn't work. If you don't have anyone to help you, then make sure you repeat the treatment after 7 days, just in case any of the nits have hatched. Alternatively, you can seek out one of the head lice clinics that I mentioned previously. So thanks for joining me on our journey through head lice. I'd love to hear about your experiences with head lice, so make sure to comment below. If you want to see more like this, don't forget to subscribe, and we'll see you next time.